The industry expects the finance minister to come up with provisions for economic revival. So precisely the Union Budget 22-23 should essentially focus on demand generation, job creation, which is very important now, healthcare as it did in the last year's budget. We also need to look at hand-holding a lot of MSMEs because they were the ones which bore the brunt, and enabling the economy to regain the lost thrust to ideally reach the double digit growth which it should have by this time. So hello everyone, I am Dr. Rajiv Chhibber. I am Vice President Sahajanand Medical Technologies Limited, and I'm also the Joint Coordinator for IMED, which is the National Forum for Medical Devices. Today, I'll be speaking on the expectations the industry, especially the pharmaceuticals and the medtech industry has for the Union Budget 2022-23. So, as the healthcare sector goes, there are a number of steps which were taken by the government in the last 2 odd years that were very, very positive, and this clearly demonstrated the importance that the sector now clearly has. Further, if you look at it, in any case, the Union Budget 21 gave impetus to the healthcare sector by increasing allocations. But this year we need to go beyond that because affordable healthcare for all is something which needs to be in continuity. So I would say that the pharma and the medical device sector, it's gained a lot of momentum owing the Atmanirbhar Bharat initiatives. So a couple of things which we from the sector, especially from the medtech sector, we kind of like propose is that the government, while it's looking at improving healthcare affordability in India and spreading its benefit to as many as possible areas, but the high custom duties, the burden of additional health cess, lack of incentives in R&D in the medical device sector, and creating a budgetary provision for upskilling of healthcare and healthcare workers at all levels would really expand the healthcare sector in the coming years. So I would feel that in this budget, a couple of things which are very, very necessary is that medical devices and equipments, the custom duties should be brought down to almost zero. I can give you an example from the industry where I belong from, which is the cardiovascular industry. It's only 2 or 3 companies today in this cardiovascular segment that have really become net exporters. If you look at the entire, net exports which have gone from our industry itself, we actually would want all the raw materials which are required in this industry to have a zero custom duty on that. That will really help us to also grow as the PLI scheme envisions, or as the government envisions the Indian companies to also make a mark in the global footlong activity. Similarly, all priority settings, evidence-based decision makings, looking at vulnerable population groups, and also achieving self-sufficiency, accessibility, availability, and affordability will help the industry when the government also develops a larger domestic market. Now, this is important. We need to create a larger domestic market within the medical device ecosystem. The government needs to invest in all healthcare areas and build critical volume so that we players can tap into it. What's happening now is there's a plethora of players globally also tapping into that volume. So if we clearly get a mandate to tap into that larger volume, the PPO, by the DPIIT and the Department of Pharmaceuticals was welcome, but we need to really expand it. The other area which we want is, that Ayushman Bharat needs a national and a centralized reimbursement agency. The idea is to have a commonly recognized agency that will simplify reimbursement processes. It accepts upgradation of technology and R&D in the medtech sector, and has provisions to include newer medical device versions in the reimbursement sector, like it is being done in in the Western countries like France, Japan, or even USA, where populations get the best device and are getting better healthcare possibilities. And lastly, we as a country are completely in awe with the Prime Minister's version at the World Economic Forum. He reassured that India will be a global hub for healthcare and global supply chains at the World Economic Forum in Davos. Now, a balancing act with which recognizes the growth impetus and also inclusiveness would do immensely well for the Indian pharmaceutical and the medtech sector, not only in the short term, medium term, but also in the long term. So while the fundamentals are still strong and supportive, and thanks to the government thinking on it on a regular basis, the right fiscal announcements, policy measures will decide how India comes out from the crisis in this post-pandemic world. So we from the industry have a very high expectation from the upcoming finance budget.
For more updates, please subscribe to our YouTube channel and press the bell icon.